The Global Health Workforce Alliance says the world needs another 4.3 million health workers, and it is the developing countries which are the most in need. According to the GHWA, sub-Saharan Africa is particularly affected by the lack of skilled medical staff, with an additional 1 million health workers needed for this region alone. The shortage makes it difficult to face a variety of health issues, including malaria, HIV/AIDS and tuberculosis, pregnancy and childbirth, and vaccinations for children. Leading efforts to find a solution to this problem, the group of Commonwealth countries have set the pace by forging an agreement on ethical recruitment of medical staff and developing professional training programs to help poor nations educate their workforce. Peggy Vidot is a health advisor at the Commonwealth Secretariat.
Sub-Saharan African countries carry 25% of the global burden of disease, but yet they have only got 3% of the health workforce in sub-Saharan African countries. As such, immediately it puts them, out on a league on their own.
According to the GHWA, part of the problem is that wealthy nations recruit doctors, nurses and other health professionals to make up their own shortfall, thereby exacerbating the need in the poorest countries. South African Miriam Makweti has worked as a nurse in Britain for the past 6 years. She came to the UK before the Commonwealth's Code of Ethical Recruitment came into force. She sends money home each month and has no plans to leave.
I've got a car here, I've got a car in South Africa, but if I was in South Africa, I believe I couldn't have, afford my car up to this time. Maybe I'll be struggling to pay my mortgage, pay the fees for my younger brother. So because I'm up here, there's nothing like, I don't feel stress on my shoulder. I can do anything easily, whatever, most of the things, I can do them without any stress.
The GHWA is working on creating a global code of ethical recruitment modelled on the Commonwealth Agreement to stop the transfer of skilled workers from third to first world health systems. The group is also hoping to secure funding to help developing nations with the help of healthcare experts like Peggy Vidot.
We also need to be looking at scaling up education and training of health workforce. We know we do not have enough health workers of different cadres, of different skills, and this is a global issue and needs to be addressed, therefore, globally.
The GHWA estimates it will cost an additional $2.6 billion a year to educate and train 1.5 million health workers over a 10-year period in Africa alone. The alliance has asked G8 leaders to address this matter in their upcoming meeting in Japan. Catherine Drew, VOA News, London.